Kirklees Visual Impairment Strategy. Track 1. Contents, Track Listings and Introduction. Track 2. Aim of Kirklees Visual Impairment Strategy. Track 3. Outcomes. Track 4. Where are we now? Track 5. Local issues and barriers. Track 6. How we will achieve our aim. Track 7. Conclusion. Track 8. Appendices. For people who find it difficult to read print, Kirklees Transcription Service provides transcription of documents into a range of alternative formats. Telephone 01484 221955. Email transcription.service@kirklees.gov.uk. This document can also be made available in languages other than English. Telephone 01484 223232. Email languages@kirklees.gov.uk. Forward. The circumstances and experiences of people living with visual impairment are unique to each individual. The challenges they experience could be anything from using public transport to safely performing tasks that were once considered simple, such as making a cup of tea. When people begin to lose their sight, they may feel that the life which they were familiar with has come to an end. Getting used to what is happening can be difficult, frustrating, and frightening. Similarly, finding out that your child has a visual impairment can feel like a ride on an emotional roller coaster. Recognizing the challenges that health and social care services face in significant cuts to budgets, an aging population, and changes in public expectations, we welcome and support this visual impairment strategy by Kirklees Blind and Low Vision Group. The strategy will help to remove and overcome the barriers faced by people with a visual impairment, help us to develop new ways of working, maximize the impact of what we do, and think more creatively about how we can work together to prevent avoidable blindness in Kirklees. Richard Parry, Director of Commissioning, Public Health and Adult Social Care, Kirklees Council. Chris Dowes, Chief Officer, North Kirklees Clinical Commissioning Group. Carol McKenna, Chief Officer, Greater Huddersfield Clinical Commissioning Group. Introduction. Demographic forecasts show that by 2021, 40% of the population will be over 50 years. A significant proportion of visual impairment is related to age. 1 in 8 over 75s and 1 in 3 over 90s have a serious visual impairment. Diabetes, and hence diabetic retinopathy, among children and young adults is also increasing, and this too will prove a challenge to service providers. Research suggests a clear economic case for early and effective intervention. An Australian study found that for each dollar spent on eye care and the prevention of sight loss, there could be a $5 return to the community. Reference UK Vision Strategy 2013-18, Setting the Direction for Eye Health and Sight Loss Services, a Vision 2020 UK initiative led by RNIB. www.vision2020uk.org.uk/UK Vision Strategy. Kirklees Blind and Low Vision Group, made up of blind and visually impaired people and professionals working in the field, have developed this strategy taking into consideration consultation with local groups and individuals with a visual impairment and national and local legislation, guidance and reports. The document gives an overview of where we are now, what outcomes are important for visually impaired people, and what we can do to remove or overcome barriers that exist locally. The strategy is primarily aimed at adults with a visual impairment, and although it contains some recommendations, it is not intending to be comprehensive for children with a visual impairment. Throughout this document, the terms visually impaired and visual impairment are used to include people who are born blind and people who acquire a visual impairment. Terms such as sight loss are only used when quoting from other documents. Aim of Kirklees Visual Impairment Strategy. The overall aim of this strategy is to improve outcomes for people with a visual impairment and prevent avoidable blindness across Kirklees, reducing demand on high-cost services. The values and principles that will influence, underpin and guide the work we undertake to achieve our aim include a social model approach challenging the barriers faced by visually impaired people, the well-being, independence and participation of visually impaired people locally, a focus on equality, outcomes and person-centered support, and dignity, safety and respect.
Outcomes. Seeing It My Way, launched at the UK Vision Strategy Conference in 2012, is a universal quality and outcomes framework outlining 10 outcomes that you visually impaired people say are important to them. 1. That I understand my eye condition and the registration process. 2. That I have someone to talk to. 3. That I can look after myself, my health, my home and my family. 4. That I can receive statutory benefits, information and support that I need. 5. That I can make best use of the sight I have. 6. That I can access information, making the most of the advantages that technology brings. 7. That I can get out and about. 8. That I have the tools, skills and confidence to communicate. 9. That I have equal access to education and lifelong learning. 10. That I can work and volunteer. www.rnib.org.uk/about-ib-what-we-do-it-my-way. The importance of these outcomes was reflected locally. We have therefore used them in this strategy to link with our key themes and objectives later in the document.
Where we are now. Progress over the last 6 years. A number of local activities took place during 2006 to 2007, including a commissioning review of adult sensory services, the development of a strategy to support adults with a visual impairment, and an ad hoc scrutiny review of services for visually impaired people. As a result, there has been some real progress in service provision and access to support for people with a visual impairment, including a council adult sensory service, a rehabilitation, equipment, information and advice service, an eye clinic liaison officer ECLO service, and Kirklees Blind and Low Vision Group. Visual impairment data. Nationally, the UK Vision Strategy tells us that currently 2 million people across the UK live with sight loss, and by 2020 this number will have increased by 22%. Locally, at February 2014, almost 7,000 people were known to Kirklees Council as having a visual impairment, representing approximately 1.6% of the total population. The majority of these, 81%, were 65 years and over. The above figures include those people registered as partially sighted or blind that have been issued with a certificate of visual impairment, a legal document provided by ophthalmic consultants at the time of registration. Kirklees Council's register of blind and partially sighted people showed at the 1st of April 2014 that there were almost 2,000 people registered in Kirklees with a visual impairment. More data can be found in Appendix A. Prevalence among black and minority ethnic communities. Among older people living in the UK, white people have the greatest risk of developing macular degeneration. Asian people have a higher risk of cataracts compared to other population groups. Black and Asian populations have a greater risk of diabetic eye disease than other population groups, and the risk of glaucoma is much higher for the black population compared to the white population. Reference: Sinclair et al. 2014. Sight loss in older people. The Essential Guide for General Practice. UK Vision Strategy. Website: www.vision2020uk.org.uk/UK Vision Strategy/GP Guide. National and local drivers. In developing the strategy, it was important, in addition to local consultation, to consider national and local policy and guidance to find supporting evidence, identify additional priorities, and identify existing resources that can support implementation of our action plan. Listed below are 2 key documents. More detail and web links can be found in Appendix B. Kirklees Physical and Sensory Impairment Goals 2010 to 2020 sets a 10-year vision and is used by Kirklees Physical and Sensory Impairment Partnership Board to help prioritise its work programmes. UK Vision Strategy 2013 to 2018 sets a strategic framework for improvement of eye health and outcomes for people with a visual impairment. Visual Impairment Pathway. The pathway for people with a visual impairment in Kirklees reflects the UK Vision Strategy pathway. The aim of the pathway is to help people with a visual impairment get the right support at the right time, and from the right person, whether they work for health, social care, or the voluntary and community sector. It is a process map describing how the principles of best practice can be applied to service delivery, to ensure early interventions to address presenting needs, rehabilitation delivered by specialist qualified professionals, interventions that help maximise functional vision, a community care assessment of eligibility for adult social care if people have unmet needs after receiving early intervention services. The range of support available to people with a visual impairment across Kirklees is outlined in Appendix C.
Local issues and barriers. As well as identifying current and future population, eye condition trends and support available locally, we need to consider local needs and issues. These are the things that may impact on the health of the local population, or the likelihood that populations will seek access to prevention, eye health and visual impairment support. These include issues that emerged during local consultation with visually impaired people and the people who support them. Prevention. Prevention is the golden thread running throughout all the themes in this strategy. Having a preventative approach includes raising self-awareness of eye health, promoting independence and self-care, and ensuring early diagnosis and intervention to delay progression of visual impairment and reduce demand on high-cost services. The UK Vision Strategy tells us that commissioners will spend an average of £4.27 million on eye care per 100,000 head of population, and yet over 50% of sight loss is due to preventable or treatable causes. Reference: UK Vision Strategy 2013-18, setting the direction for eye health and sight loss services, a Vision 2020 UK initiative led by RNIB. At www.vision2020uk.org.uk/UK Vision Strategy. A public health indicator for preventable sight loss was introduced in England April 2013. Its aim is to measure the number of all people who are certified sight impaired or severely sight impaired, and the numbers of people who have lost their sight from one of 3 major causes of preventable sight loss in the UK: glaucoma, age-related macular degeneration, and diabetic retinopathy. Reference Sinclair et al. 2014, Sight Loss in Older People, The Essential Guide for General Practice, UK Vision Strategy. http://www.vision2020uk.org.uk/UK Vision Strategy/GP Guide. Kirklees Blind and Low Vision Group welcome this measure and recommend the development of a local cross-sector prevention and early identification strategy alongside a new visual impairment and eye conditions section of Kirklees Joint Strategy Needs Assessment, the JSNA, showing links to such things as deprivation, ethnicity and other health conditions to help identify local priorities to prevent avoidable blindness. Raising awareness. We know that for various reasons there are many people with a visual impairment not known to services. Living with a visual impairment is complicated and each person has a different story. Some people are born blind, some are not aware that they have lost part of their sight. Some people have a visual impairment secondary to other conditions such as stroke, dementia or a learning disability, and this is sometimes overlooked. Some people may not seek help because of a belief that visual impairment is just a part of getting old and nothing much can be done about it, and others may be struggling to come to terms with their visual impairment and feel too embarrassed or vulnerable to let others know they are experiencing problems. This is not an issue specific to Kirklees, although it does need tackling locally. Increased awareness activities such as sensory awareness training, outreach activities during National Eye Health Week and supporting partner organisations to have a presence in public places such as town centres should help more people understand their visual impairment, encourage them to make themselves known and where necessary seek support at an early stage.
Access to health services. Ophthalmology outpatient attendances are rising year on year, and the demand for eye care is set to increase significantly as the population ages. Reference Martin M. 2013, Research Discussion Paper number 12, Falls in Older People with Sight Loss, a Review of Emerging Research and Key Action Points, Thomas Pocklington Trust. http://www.pocklington-trust.org.uk/research and knowledge/latest/RDP 12. RNIB research indicates that primary eye care services have a limited awareness or understanding of eye health and a symptom-led demand for eye examinations. In secondary eye care services, the research identified that many patients found the eye care system fragmented and confusing, which can exacerbate an already anxious experience. Locally, people told us about how difficult it can be to access health services generally, including the lack or wrong format of information regarding hospital appointments, navigating around hospitals, eye care professionals that lack an understanding of other health conditions such as dementia, and forms that need completing by a visually impaired person before they can have dental treatment. People have different levels of sight and therefore require information in different formats. The Blind and Low Vision Group would like to see increased awareness raising and understanding of eye health in primary eye care services and a move from a symptom-led demand for eye examinations to one which encourages people to have regular eye examinations in order to detect eye conditions in the early stages. The Blind and Low Vision Group would also like to see improved communication from hospitals regarding a patient knowing about and attending an appointment, eye care professionals with a better understanding of other health conditions such as dementia, improved physical access in hospitals, such as signage, steps and handrails, and staff in other health services, such as dentistry, that have a basic understanding of how to support a person with visual impairment. Certification and registration. The Royal College of Ophthalmologists believes that an important component of good clinical care by ophthalmologists is the offer of a Certificate of Vision Impairment, CVI, to eligible patients. The College encourages its members to promote the uptake of the CVI amongst patients who are likely to benefit from it, and to facilitate the process of registration as far as it is in their power to do so. To support this work, they have partnered with RNIB and Vision 2020 UK to promote the benefits of CVI, and RNIB have produced a YouTube video for patients encouraging registration. http://youtu.be/for lowercase I capital X underscore 0 underscore capitals SILOE. Nationally, there is a decline in new visual impairment certifications and registrations. Locally, we saw an 11% decline in new registrations between the 1st of April 2011 and the 31st of March 2014. Kirklees Blind and Low Vision Group would like to see more encouragement and support around the certification and registration process, as this not only helps people to get early support, but it also helps commissioners to plan and to develop the right services for the right people in the right places.
Moving around safely and independently. People told us that signage and landmarks can be a problem in hospitals, and many mainstream services in the community can be difficult to access because, for example, they have steps where people cannot see where they start and end, no handrails to guide people, no contrasting flooring, and very few ramps. These are all barriers that prevent visually impaired people from navigating safely in indoor and outdoor environments, escalating their risk of falling and jeopardizing their independence. The increased risk of falls can have a significant adverse health impact on people with visual impairment. Older people with sight loss are 1.7 times more likely to have a fall and have 90% higher odds of multiple falls than a person with no sight loss. Reference UK Vision Strategy 2013-18, Setting the Direction for Eye Health and Sight Loss Services, a Vision 2020 UK initiative led by RNIB. www.vision2020uk.org.uk/UK Vision Strategy. Falls are the most common cause of hospitalisation for people aged over 65, and women with macular degeneration fall at nearly twice the rate of women without. Reference Martin M. 2013, Research Discussion Paper number 12, Falls in Older People with Sight Loss, a review of emerging research and key action points, Thomas Pocklington Trust. www.pocklington-trust.org.uk/research and knowledge/latest RDP 12. Kirklees Blind and Low Vision Group would like visually impaired people to have more influence on local planning applications to try and improve access. Local falls prevention activities that include and are sometimes targeted at visually impaired people and include awareness of obstacles, to help people understand what causes an obstacle for a person with visual impairment. Information and advice. Local people told us how important it is that the approach to supplying information is flexible and responsive, making sure it is offered or easily available to the person with visual impairment at the appropriate times. Support at the point of diagnosis is vital, but if people are coming to terms with an initial diagnosis, they may not want to think about anything else at that point. It may be that their circumstances change over time, and therefore offers of information and referrals should be made on multiple occasions. In addition, some Kirklees residents go through eye clinics in neighbouring authorities. For example, people with macular degeneration are likely to go through to the Calderdale Eye Clinic. It is important that these people are aware of the support available locally. Visually impaired people also have an important role to play in helping others in similar situations. They have a wealth of knowledge and experience, and within the right environment, people feel it is important to share their coping strategies and provide mutual support. Kirklees Blind and Low Vision Group would like to see ongoing information and advice to people newly diagnosed with a visual impairment, and continual work to explore new ways of providing information for people and carers of people with a visual impairment, including ongoing publicity of the support and activities available in Kirklees, the availability of alternative formats, and the role of the transcription service.
Rehabilitation and independence. Some visually impaired people use guide dogs, technology and peer support, amongst other things, to lead full, rewarding and independent lives. But without support to learn to do things for themselves, some people rely heavily on family and friends, which, they say, can sometimes affect their confidence. Local people told us that access to support as early as possible to learn new ways of doing daily tasks and training to remain mobile and get out and about is an important part of rebuilding a sense of identity and confidence. Suggestions were that this could include some kind of living with a visual impairment course that has been trialled in other areas. The local rehabilitation and equipment service is important in helping people to regain or remain independent, along with equipment and assistive technology. Local visually impaired people feel that it is important that they have involvement in the development of local strategies relating to equipment and assistive technology, and are able to view and try equipment where necessary. Kirklees Blind and Low Vision Group also welcome a wider discussion and agreement on what should be included in the core list of equipment for people with a visual impairment, and what people can reasonably be expected to provide for themselves. Locally, people talked about embracing technology, whilst others thought it was not for them. Barriers to technology include the expense, which restricts who can purchase it, and having to purchase something before you know whether it is useful. People talked about the need to share knowledge and experiences about technology to help reduce concerns people may have, including information on cheaper alternatives to expensive items.
Social isolation and depression. Studies estimate that mild age-related macular degeneration, or AMD, causes a 17% decrease in the quality of life of the average patient. Moderate AMD causes a 40% decrease in quality of life, and severe AMD causes a 63% decrement in quality of life, decrease similar to that associated with a severe stroke that leaves a person bedridden. The reference, UK Vision Strategy 2013-18, setting the direction for eye health and sight loss services, a Vision 2020 UK initiative led by RNIB. www.vision2020uk.org.uk/UK Vision Strategy. Visual impairment irrevocably changes people's lives, affecting their view of themselves, their relationships and their world. During local consultation, people talked about experiencing fear, confusion and lack of confidence, which can sometimes lead to social isolation. Some people feel they need support to take to the streets again and to start enjoying the everyday community activities that they used to enjoy. The UK Vision Strategy says that people with sight loss are likely to live alone, indicating that they may be amongst the most vulnerable and most isolated. And although some community activities exist locally, Kirklees Blind and Low Vision Group would like to see more work done to prevent the social isolation of people with a visual impairment, especially older people. The UK Vision Strategy also highlights the increased risk of depression as a significant adverse health impact associated with sight loss. Older people with sight loss have an increased risk of depression at a rate of 13.5% compared to 4.6% in people with good vision. Kirklees Blind and Low Vision Group would like to see a visual impairment and eye conditions section of Kirklees JSNA and associated links with mental health.
Other health conditions. Visual impairment may be due to or present alongside other health conditions including stroke, diabetes, dementia and a learning disability. The combination of both can be overwhelming for the individual and family, and if not recognised and treated, can be much harder for individuals to benefit from rehabilitation. More detail of these health conditions and how they associate with visual impairment can be found at www.vision2020uk.org.uk/UK Vision Strategy/GP Guide. During local consultation, we heard how intense these situations are for carers and are concerned that some patients may leave hospital, for example, after a stroke with an undetected visual impairment. This particular concern is currently being addressed in South Kirklees with the development of a stroke pathway led by orthoptists. Sight loss may be underdiagnosed in people with dementia and vice versa, because the effects of each condition may conceal the presence of the other. Reference: Thomas Pocklington Trust, 2012. Dementia and End-of-Life Care. Implications for People with Sensory Loss, SCIE. People who have no cognitive impairments may learn to adapt to sensory loss, but when they have dementia, this may affect their perception of the world. As a result, people may make visual and auditory mistakes, which can lead to illusions and misperceptions. For instance, a shadow may be seen as an animal, or hallucinations may be felt to be real. Reference: Sinclair et al., 2014. Sight Loss in Older People. The Essential Guide for General Practice, UK Vision Strategy. During the writing of this report, we learned how sight tests for people with a learning disability transformed people's lives. Kirklees Blind and Low Vision Group feel strongly that people with dementia or a learning disability should have access to regular sight tests and for more optometrists to register on the Seeability website, www.seeability.org.
Sport and leisure. In 2012, the Federation of Disability Sports Organisations carried out research to look into the provision of sports activities for disabled people living in Kirklees. Some of the issues highlighted in the report were that people with a sensory impairment expressed a concern over safety in public swimming sessions and struggled to take part in organised classes or lessons, as the instructor is not always understanding of their communication needs. http://www.kirklees.gov.uk/involve// /published doc.aspx (REF) equals D4 M6 UQ EM ampersand E equals 568. Kirklees Blind and Low Vision Group would like to know more about the progress in implementing the recommendations in the report, especially those around sensory awareness training for staff and ensuring people's safety. Discussions locally highlighted the need to improve access to mainstream leisure activities for people with a visual impairment, develop more inclusive leisure and sporting activities, and, where necessary, develop specific activities for people with a visual
Education
impairment,
and employment.
including those
Blind
with
and
a learning
partially
disability
sighted people
and people
are
with
significantly
dementia.
less likely to be in paid employment than the general population or other disabled people. Only 1 in 3 registered blind and partially sighted people of working age is in paid employment. They are nearly 5 times more likely than the general population to have had no paid work for 5 years. Those with a degree or higher award still only have the same chance of getting a job as someone with no qualifications in the general population. Perhaps this is unsurprising when 9 out of 10 employers rate blind and partially sighted people as either difficult or impossible to employ. Reference: Saunders, 2013, Tackling Unemployment for Blind and Partially Sighted People, RNIB. www.rnib.org.uk/knowledge-research-hub/research-employment. Kirklees Blind and Low Vision Group would like to see barriers to employment for visually impaired people minimised and recommend more work locally to ensure that health and social care recruitment and employment procedures do not discriminate against visually impaired people. They also feel it is important to make people aware locally about support available through access to work, continue to develop opportunities for visually impaired people to build confidence and improve skills, and for information and support to be in place for those people who want to undertake lifelong learning and training. Children and young people with a visual impairment. Kirklees Blind and Low Vision Group recommend work locally to identify how we measure up to the recommendations in the UK Vision Strategy 2013-18 regarding transition and identifying and addressing potential sight problems among children and young people to establish or maintain a clear and smooth transition pathway from children's and young people's services to adult services, thus ensuring young people are enabled to fulfil their potential and build their confidence, and that rights to benefits and support are not lost during the transition. This applies equally to health services and social care services. Identify and address potential sight problems among children and young people. Plans should include increasing implementation and awareness of the National Screening Committee programmes that follow existing best practice, particularly for those at higher risk of sight loss.
How we will achieve our aim. The overall aim of this strategy is to improve outcomes for people with a visual impairment and prevent avoidable blindness across Kirklees, reducing demand on high-cost services. Using the themes of physical and sensory impairment, partnership board goals, Seeing It My Way, outcomes, and national and local emerging evidence, the following objectives have been developed to help us achieve our aim. For children, progression through the themes will be at an age-appropriate level. Qualified teachers of visually impaired children, along with specialist support assistants, resource technicians and rehabilitation officers provide support from birth to adulthood in a variety of settings. These professionals will work in partnership with others to support the development of all key themes for visually impaired children.
Theme 1. Living independently, including rehabilitation, equipment and assistive technology, communication, mobility and transport. Outcomes for people with a visual impairment. I can look after myself, my health, my home and my family. I can make best use of the sight I have. I can get out and about. I have the tools, skills and confidence to communicate. Example of support currently available. Sight Kirklees Independent Enablement Services, SKIES, provide rehabilitation, equipment, information and advice. Kirklees Council Sensory Service, Adults, assess visual impairment support needs, provide information and advice and referral to specialist professionals and signposting relating to all aspects of independence. Visual Impairment Team, Kirklees Education, includes preschool, school support and rehabilitation training for children and young people. Kirklees Visual Impairment Network, CAVIN, have computer and telephone equipment for people to view and try. Low Vision Aid services in North and South Kirklees. Key objectives of this strategy are for 1.1. People with a visual impairment, where needed, to have access to local rehabilitation support. 1.2. People with a visual impairment to have access to suitable equipment and assistive technology. 1.3. People with a visual impairment to be able to move around Kirklees independently and safely. 1.4. People with a visual impairment to receive their full benefit entitlement.
Theme 2. Choice and Control, including information and advice, leisure, social and sport. Outcomes for people with a visual impairment. I have someone to talk to. I can access information making the most of the advantages that technology brings. I can get out and about. Example of support currently available. iClinic liaison officers provide support at point of diagnosis. Kirklees Council Transcription Service provides a talking newspaper, search for audio books and information, for example leaflets in different formats. Kirklees Directory of Services for people with sight loss. Kirklees Council Care Navigation Service to access community activities. Directory of Sport and Physical Activity for disabled people in Kirklees. Various sporting activities including Kirklees Disability Swimming Club, indoor bowling and goal balls for adults, and Actionaries for 4 to 16 years and Flame Club for over 14 years. Key objectives of this strategy are for 2.1. People with a visual impairment to have access to information, advice and emotional support by knowledgeable people and in their appropriate formats. 2.2. People with a visual impairment to have access to and a choice of a wide range of leisure and social activities.
Theme 3. Active and Equal Citizens, including paid work, voluntary work, lifelong learning, training and involvement. Outcomes for people with a visual impairment. I have equal access to education and lifelong learning. I can work and volunteer. Example of support currently available. A variety of computer and IT training via voluntary organisations and community venues such as libraries. Disability employment advisors at Job Centre Plus provide advice and support to take the first steps to employment. Ambitions for Kirklees: empowering and building the skills for work and independent living of young people and adults with disabilities. Access to Work can offer practical and financial support, for example, specialist equipment, travel and a communicator at a job interview. Supported volunteering service via Gateway to Care, Kirklees Council. Kirklees Education Visual Impairment Team provides transition support from education to further education or work. Kirklees Blind and Low Vision Group provides an opportunity for people with sight loss to get involved in planning and developing services locally. Key objectives for this strategy are for 3.1. People with a visual impairment to have access to local employment opportunities and opportunities to develop their skills and knowledge. 3.2. People with a visual impairment to guide the development of services to support visually impaired people locally.
Theme 4. Health and Wellbeing, including access to health and social care services, eye health and self-care. Outcomes for people with a visual impairment. I understand my eye condition and the registration process. I can look after myself, my health, my home and my family. I can receive statutory benefits and information and support that I need. Example of support currently available. Health trainers provide support and motivation on a range of long-term health conditions. Eye clinic liaison officers act as a bridge between health and social care community support. Yorkshire Transport Services provide support for hospital appointments. Visual impairment identification cards. Welfare benefits and quality of life assessments. Key objectives of this strategy are for 4.1. People with a visual impairment to attend hospital appointments independently, where they choose to do so. 4.2. Visually impaired people with dementia or a learning disability to have equal access to eye care services locally. 4.3. People with or at risk of a visual impairment to understand and take responsibility for their own eye health. 4.4. People with a visual impairment to receive the right eye care support at the right time. 4.5. A clear and smooth transition pathway from children's and young people's services to adult services.
Theme 5. Prevention, including raising awareness and prevention of blindness. Outcomes for people with a visual impairment. I can look after myself, my health, my home and my family. I can make best use of the sight I have. Example of support currently available. Various screening programs such as UK National Diabetic Screening, Glaucoma Screening and Vision Screening Programme, 4 to 5 years. Vision Screening at Child Development Unit, CDU, and special schools. Stroke Pathway to diagnose sight problems and provide early intervention. Basic Sensory Awareness e-learning package available to all council staff and sensory awareness training for key staff. Self-Care Hub. Key objectives of this strategy are to 5.1. Collect and collate improved data on visual impairment in Kirklees. 5.2. Increase activities to prevent avoidable blindness in Kirklees and delay visual impairment progression.
Working in partnership and measuring success. Kirklees Blind and Low Vision Group have a critical leadership role, and board members have an individual and collective responsibility to champion the changes required to ensure success in achieving the aim of this strategy. The group will do this by spreading clear and consistent messages about what we want to achieve, forming constructive relationships and engaging partners to support its implementation, thinking creatively and breaking down barriers. In terms of feeding into the decision-making process, the Partnership Commissioning Manager for Physical and Sensory Impairments will feed into Kirklees Physical and Sensory Impairment Partnership Board and Integrated Commissioning Group for Physical Wellbeing, Ageing Well and Independence. This group ensures a single approach to commissioning across health and social care services in Kirklees and includes representatives from Greater Huddersfield Clinical Commissioning Group, North Kirklees Clinical Commissioning Group and Kirklees Council.
Conclusion. The number of people with a visual impairment in Kirklees is set to increase alongside a growing older population, resulting in more people living with a visual impairment alongside other complex health conditions such as diabetes, stroke, dementia and learning disability. Significant progress has been made over the last 6 years to improve the independence, involvement and quality of life for people with a visual impairment. This strategy builds on this progress and provides a framework to further progress over the next 6 years to help prevent avoidable blindness across Kirklees and shape local support. The next step is to translate the recommendations in this report into an implementation plan that outlines the actions needed, the people responsible for making them happen, the timescales, and what success will look like. Kirklees Blind and Low Vision Group will monitor the plan on a regular basis and continually update as progress is made, taking into account new emerging issues and changes in laws, policy or service provision that may affect the plan and address any areas not previously considered.
Appendix A, Visual Impairment Data. Nationally, the UK Vision Strategy tells us that currently 2 million people across the UK live with sight loss, and by 2020 this number will have increased by 22%. The vast majority of people with sight loss are older people, although an estimated 80,000 working age people and in excess of 25,000 children in the UK are affected by sight problems. Around 980,000 people live with irremediable or certifiable sight loss. The leading causes are age-related macular degeneration, AMD, glaucoma and diabetic retinopathy. Cases of diabetic retinopathy show the most marked increase, particularly among the over 65s, where figures have more than doubled. www.vision2020uk.org.uk/UK Vision Strategy. Locally, the collection of local data can help us to identify where there are gaps in support. It can also help us to target prevention activities at high-risk groups to lessen the likelihood of visual impairment and raise awareness of eye health. In 2014, it was estimated that 170 people aged 18 to 64 living in Kirklees had a serious visual impairment, and 6,123 people aged 65 years and over had a moderate or severe visual impairment, which was predicted to rise by 12% to 6,862 by 2020. www.pansi.org.uk. At February 2014, 6,976 people were known to Kirklees Council as having a visual impairment, representing approximately 1.6% of the total population. 5,635, 81%, were 65-year-olds and over. 97, 1%, were deaf-blind. 4,950, 71%, were dual sensory loss. 4,521, 65.5%, were female, and 2,379, 34.5%, were male. 2,755, 40%, were from North, and 3,760, 54% were from South Kirklees. Those figures include those people registered as partially sighted or blind that have been issued with a certificate of visual impairment, a legal document provided by ophthalmic consultants at the time of registration. Kirklees Council Register of Blind or Partially Sighted People showed at 1st of April 2014 that there were 1,889 people registered with a visual impairment. 1,007, 53%, were registered as blind or severely sight impaired. 882, 47%, people were registered as partially sighted or sight impaired. The majority, 1,334, 71%, were aged 65 years or older. 555, 29%, were between the age of 18 and 65 years. Eye conditions. The National Eye Health Epidemiological Model NEHEM website www.eyehealthmodel.org, accessed May 2013, tells us that in Kirklees there is a best mean estimate of 3,338 cases of glaucoma, 1.42% of the 30 years and overpopulation. There are a suspected 13,268 cases of glaucoma, 8,030 under 60 years, and 5,238 60-plus years. There is a high estimate of 11,510 cases of cataracts, 6.54% of the 40 years and over population. There are an estimated 2,090 cases of neovascular age-related macular degeneration, wet AMD, 1.69% of the 50 years and over population. There are an estimated 13,554 drusen cases, 10.94% of the 50 years and over population.
Appendix B. National and local drivers. Kirklees Physical Sensory Impairment and Long-Term Conditions, PSI and LTC Goals 2010 to 2020, was based on 3 consultation events during 2009. The aim is to show how things should be for people with a PSI and LTC by 2020 and is used by Kirklees PSI and LTC Partnership Board to help prioritise its work programmes, gain shared agreement on commissioning priorities, and act as a means of measuring our performance in improving services and support. The Blind and Low Vision Strategy is one of a number of strategies to have fallen out of the 2010-2020 goals and shows what will be done to achieve the goals outlined under the themes: living independently, choice and control, active and equal citizens, and health and well-being. Kirklees 2008 Vision for Older People. Living Life to the Full was developed to help people aged 50 and over to plan for the future and find the information they need to live their lives to the full. The document recognises that most people over the age of 60 will need to wear glasses, and the importance of caring for eyes is stressed under the theme Health and Well-being. People are advised to have regular eye tests which are free to the over 60s and can pick up early signs of eye conditions of which they may not otherwise be aware. The first Joint Health and Wellbeing Strategy, JHWS, for Kirklees